some initial thoughts I had about the patient before looking into the drugs that he's taking and how they interacted and all those things were, the patient seemed pretty nervous, so I may need to look into an anti-anxiety medication or stress reduction strategies. And then from what I already knew about some medications, simvastatin causes orthostatic hypotension, so that might require us to raise the chair slowly and to have him wait 2 minutes before standing up. And then metoprolol succinate is for hypertension, and it can cause xerostomia, so we may need to assess his salivary flow. And then also lisinopril, which is also used for hypertension, can cause a dry cough, so that may interfere with lung dental procedures. Another thought I had was NSAIDs such as aspirin can diminish the antihypertensive effects of ACE inhibitors, so that may be why he still has a high blood pressure even though he's on antihypertensive medications, because he, according to his blood pressure, which was 139 I think over 88 excuse me, it still puts him at stage 1 of hypertension. Another thought that I had was ginger and aspirin are both blood thinners, so that might be an important thing to keep in mind before beginning scaling. And it may not show because he's a smoker and bleeding is often masked in smokers, so it's just something that we'd have to keep an eye out for in treatment. And then other drugs that I knew of before was levothyroxine is for hypothyroidism. Aspirin is for arthritis. Levodopa carbidopa is for Parkinson's. And then I wasn't sure what omeprazole and ginger and fish oil were used for, so I had to look that up. And then another thought I had, he had a coated tongue, so I thought maybe he had troubles with dexterity due to his Parkinson's with brushing, so that may be why he has a coated tongue. And then it also said that he had nicotine stomatitis, and then localized stain on the maxillary and mandibular anteriors, and then a buccal burn mark. So those could all be from smoking. Oh yeah, I forgot to say that simvastatin is for high cholesterol. As for treatment modifications, he may have many treatment modifications, such as we would need to assess his salivary flow due to the xerostomia from some of his medications. Have to monitor vital signs due to his hypertension. Use stress reduction strategies due to the signs of stress and anxiety. Use vasoconstrictors with caution. And then he also may have the dry cough, as I said earlier, that would interfere with lung dental procedures as a side effect of lisinopril. And then several drugs that he's taking have GI side effects, so we may need to put him at a semi-supine position to see if he's more comfortable. And then also orthostatic hypotension is a side effect of simvastatin, so just raising the chair slowly, having wait 2 minutes, as I said earlier. And then also the combination of ginger and aspirin, they're both blood thinners, so there might be a chance of increased bleeding, so we'd have to check that before scaling. So that would be a treatment modification. And then due to the drugs that he's taking, he may be more responsive to CNS depressants. That's about it for treatment modifications. As for drug interactions, aspirin and ginger diminish the antihypertensive effects of lisinopril and meprolol-succinate. And so, if he took the ginger and aspirin out of his daily routine, he would only have 3 drug interactions instead of 8, which is a big difference. And the ginger and aspirin may not be making a huge effect for him. The aspirin that he's taking is 81 milligrams, so I questioned if that's even doing anything for his arthritis. And then there's a couple other drug interactions that I saw that may affect treatment, which is lisinopril may enhance hypertensive effects of levodopa-carbidopa, so that could also contribute to his high blood pressure. And then meprolol-succinate may enhance the hypotensive effect of levodopa-carbidopa, so that wouldn't necessarily be a bad thing since he has a high blood pressure. But yeah. And then the 4 questions I had for a pharmacist would be, is the amount of aspirin he is taking doing anything for his arthritis? Because it seems like you'd need more than 81 milligrams to reduce inflammation from arthritis. And then also another question I had is, since his aspirin is interacting with many of his drugs and may not be doing much for him, is there a better alternative you'd suggest? Because it's causing so many drug interactions, so I feel like there would maybe be a better drug for him to take. And then another question I had for a pharmacist would be, is his dose for levothyroxine a mistake? Because according to the drug reference book, his dose is 500 times more than the recommended maximum dose for a person. And then also another question would be, would you recommend an anti-anxiety medication for this patient, or suggest just using stress reduction strategies? And if you did suggest a medication, what medication would that be? Because he clearly showed signs of stress and anxiety during the appointment. And then the opinion of a pharmacist would be important because they know so much more than we ever learn, from just one semester of a second. Oops. As I was saying, for the value of a pharmacist, or talking to a pharmacist about a patient's drugs that he's taking, is they have way more than one semester of education on drugs like we do, and they can also make sure that they're getting correct dosing for their drugs, and they can also look into drug interactions that their drugs are doing, and then limiting the side effects that they have that could affect, orally, systemically, or anything like that. And then also seeing if any of the over-the-counter medications that the patient is taking interact with the drugs that they're prescribed. And I think that's about it.